So, hello pharma guys, welcome to my channel Easy Learn Pharma. So, today I am going to discuss about a new interesting chapter and a very important chapter that's name is dosage form. So, what is that name? And dosage form. Okay. So, before going to the dosage form chapter, first of all, you should know the two words. One is drugs, another one is medicines. Okay. So, after that, you can easily understand what I'm telling regarding the dosage forms. Clear? So what do you mean by drugs? Drugs means what? Drugs means simply you can say that is the active pharmaceutical ingredients, that is active pharmaceutical ingredients, or you can say simply that is API. Okay, that is active pharmaceutical ingredients. Actually, the drug enters into the body, or actually the drug delivered into the body and shown the pharmacological response or shown the therapeutic response. That's why the disease will be decreases. Okay, so but you can take the drug in the raw form due to toxic effect. Okay, but you can take the drug in raw form and due to toxic effect. So how the drug you have to administer? Now when you have to mix some vehicles or some excipients or some additives, okay, or some pharmaceutical aids. Okay, so when you have to mix some vehicles, some excipients or some additives or some pharmaceutical aids in the drugs, it convert into the medicines. Okay, it convert into the medicines, and that medicines you have to administer, and that medicines available in the market, and that medicine you have to administer for reduce or for prevention the disease or for cure the disease. Okay, so what is excipients? Excipients means what? Now, there are so many excipients are there, as for example, flavoring agent, sweetening agent, coloring agent, and some binding agent, some diluent, and some disintegrating agent. There are so many excipients are used. Okay, so what is the definition of the drugs? Okay, what is the definition of the drugs? And drugs are the single active chemical entity. Okay, drugs are the single active chemical entity present in the medicine. Okay, present in a medicine that is intended for intended for prevention, prevention, cure, and diagnosis for in a human being or in animals. Okay, that is called known as drugs. So what do you mean by medicine? Now all the medicines are drugs. Okay, all the medicines are drugs, but all the drugs are not medicine. Okay, jaha bhi kichi drug achi, all the drugs are not medicine. That I'm giving one example, that is morphine, cocaine, codeine. Okay, these all are the drugs, and that all the drugs are not medicine, but all the medicines are drug. Why? Now because in the medicine the drugs will be present. So what is the composition of the medicine? Now simply you can say it drugs plus excipients. Okay, so that is the simple composition of the medicine. So what is the definition of the excipient? So why we have to use some excipients in the drugs? Okay, so what is the definition of the excipients? The excipient, actually you can say it is a excipients, or you can say it is a vehicle, or you can say it is a additives, or you can say it is the pharmaceutical aids. So what is the definition of the excipient? The pharmaceutical excipients are the substances which have no or little therapeutic value but are essential to be used in the pharmaceutical dosage forms. Okay, तार सेमती किसी effect नहीं. Okay, they have or which have no therapeutic value, but these are essential to be used in the pharmaceutical dosage form. For which purpose? To protection, for enhance the stability of the pharmaceutical dosage form. That's why you have to mix the some excipients or some vehicles or additives or some pharmaceutical aids in the drugs. Or you can say simply you can say to enhance the stability of the pharmaceutical dosage form and to give the particular shape to the formulation. Okay, that's why you have to use some excipients in the drugs and it convert into the medicines. Now come to the point. Okay, what is dosage form? Dosage form means what? Or what is the definition of the dosage form? And dosage form, actually the dosage form are the physical form in which the drug molecules are delivered into the site of action within the body. Okay, so why it is a physical form? Now, because what do you mean by physical form? Now, physical form means you can see, you can touch, you can feel it. Okay, so that's why it is a physical form. And simply you can say what is the composition of the dosage form? Now, drugs or API plus excipients. So that is the simple composition of the dosage form.